Hey guys, so I just thought I'd do a sit down just because I wanted to talk about the procedure I went through in the hospital when I went in to get my surgery done. So it's the third day post surgery now for me, and I'm feeling a lot more normal, and I don't get much sensation on my abdomen area like I used to in the first 2 days, which was yesterday and the day before, which I'll address as well on this part of the video. So first of all, I just wanted to say that I understand everyone's situation is different, and also the reason why people get the hysteroscopy DNC is also different. For me, it's because I had a growing fibroid that was pushing in on my uterus, and that could possibly cause fertility issues if I had left it there. My other option was also to get the Marina, but I went with the hysteroscopy just because I thought it would give me a fresh start, and also it's part of the option anyway. For me, it was a no-brainer to go with that. I had to fast in the morning, so I was allowed to have a light breakfast before 7, and I had to fast after that. When I went into the day surgery area, I was given a form to fill out just for me to be like checked in, I guess. And then after I filled the form out, it was just like a few signatures I needed to sign, and I needed to sign who was going to take me home, and to sign that I wasn't going to be home by myself because I needed someone with me at least for the first couple of days, just while I recover. So I signed that form and I put in the details, and the person was Danny. He was the one that was going to take care of me while I was at home, which was really amazing that I had my boyfriend there to take care of me. So after that, we went and sit in the seating area for about, I would say, 35 to 40 minutes. And then after that, someone called me to actually check me in. And when they checked me in, we just went through the same, it was pretty much the same questions that were being asked. She asked me what surgery I'm gonna get done. She asked me to confirm all my details, which I did. And she asked me if I had any piercings, which I did. So I had to take out my piercings because or any metal stuff that I had, because she said in the case of emergency, they would have to rip it off. She gave me a little container where I put in my piercings. I removed my ear piercings and my nose piercings, and I put them in the container. And then she said that they would have to do a routine pregnancy test because the surgeon or the doctor just prefers to go to do things that way. I told her it was the first day of my period, so definitely that can't be possible. That's why she said it was just a routine that the doctor likes to do to make sure everything is fine. So she's like, I'm gonna require a urine sample from you. So I did give her that, and then I got changed into my my gown, I guess, my surgery outfit, I would say. So it was just the white hospital gown, and then the little top that you wear that has an open back. And then I got given a hairnet. They put in a tag with my information on my wrist and on my ankle. I got given those blue disposable shoe things, and then I got given a locker where I put my stuff in. It didn't take long for me to be called into the surgery waiting room. So there was the general waiting room where you can wait with the person that comes in with you, or if you don't have anyone, you can wait there by yourself. And then there's the surgery waiting room where they give you a bed. So that's where I was asked to go to. It seemed like mine was a lot quicker because when I walked into the general waiting room, I saw a few people in their surgery gown still waiting to be called in. So I was quite thankful that I didn't have to wait that long in my white gown. So literally it was about 10 minutes after I changed, that's when they were like, oh, they're ready for you, so you have to go. So I said my goodbyes, gave Danny my phone to hold for me. I just followed the lady down the hallway, and then I got put on a bed, and then the guy that put me on the bed just rolled me into the surgery waiting room. And in that area as well, it was like, I don't know how to describe it, but it was just like a little waiting area. There was no sitting spots or anything. It was just the area where they pack all the beds for the people that are going into surgery. When I went in there, there was one guy in there, and then I got given another section, and the nurse just kind of pulled the curtain just for privacy. And while I was in there, another guy also came, but he was on the other side of the room. And there are usually 2 nurses there, or probably 3 nurses, but this time there were 2 nurses there, and they were really lovely ladies. This whole time, all the nurses that I had dealt with were really lovely. They were all so nice. I literally felt like a little kid again, and I felt like well taken care of and everything. So I felt like I was in safe hands pretty much. So in the waiting area, the lady asked me as well about my details, just to confirm my details, and she was like, don't worry, you're going to be asked these questions a few more times. It's just a repeated routine questions that we need to ask and make sure everything is correct. And she was an elderly lady as well, and she was just like, she was making conversation, she was being nice. She wasn't just like on the ball, like straight to questions. She was complimenting my lashes, saying her granddaughter, I think, is getting married, and her granddaughter is looking to get her lashes done as well before the wedding and all that stuff. So it was sort of that kind of vibe, very laid back. There were 2 nurses there, and I think they were like best friends or something, because like they would make fun of each other. So that made me feel like really comfortable, especially like I was there by myself at this point. So it was nice to have someone there to make you feel comfortable and you don't feel alone. Oh, and also I forgot, during the time I was being checked in, when I got my gown and when I took my piercing off, I was also given 2 tablets of Panadol. I didn't ask why I was given it, but I was thankful that I got it, because at that time my period pain was really starting to come in, so I kind of just took it. When I was given my Panadol, the lady asked me, she's like, have you taken any painkillers? I was like, no, I haven't. And she said that, when last did you eat? And I told her I had my breakfast around 7:15, which was about 15 minutes past the time they said I should cut off having breakfast, which wasn't an issue. She didn't make a big deal about it. Fast forward back to me waiting with the 2 nurses in the waiting room. I kind of started to fall asleep a little bit. I was dozing in and out. I think I waited there for about 20 minutes. 2 other nurses came in and she introduced herself. That was another thing. They were all super nice, introduced themselves. They were all really down to earth. She had a student nurse with her. She introduced the student nurse as well, with like a clipboard of my information that they wanted to go through with me as well. So it was pretty much just the same stuff, asking me my details, checking my tag. After like 25 to 35 minutes, I got wheeled in on my bed into the anesthetic room. When I went in the anesthetic room, there was more nurses there. So at this point, there was like more people coming in, and I was like getting a bit overwhelmed, because so there was an anesthetic room that I was in, and there was just like a little flap doors, and then in there was the operating room. So I was kind of like, oh shit, it's actually happening now. But I was in the anesthetic room for about 20 minutes. They were just sorting out everything, making sure everything's sorted. I got my cannula put in by a nurse, and then the person that administers anesthetic, the anesthesiologist, I think that's what they're called, she came in. She was really sweet as well, trying to like ease the tension or whatever. She was like, this is my name, this is what I'm gonna be doing. The other nurse as well that gave me my cannula, she said the same thing as well. So overall, good vibes. Everyone was really nice. I just waited for a little bit in the other room, in the anesthetic room. After about 15 to 20 minutes, I got wheeled into the operating room, and at that time, I bet you there was probably like 8 nurses in there. There were 8 people in there, I think, from what I could count, whilst I was in there, because there were obviously the people that did my anesthetics, and then there were 2 other nurses, and then there was like other people on the other side of the room. So a lot was going on. And before then I was like, okay, this is like a quick procedure, but by that time I was like, shit, this is gonna be like an actual surgery, because I was telling myself it was a quick procedure just so that I don't freak out. It didn't take long before one of the nurses just explained what was gonna happen. So she told me, okay, I'm gonna put the mask on now. Oh, and before that as well, they tried putting in the heart monitor on my finger. It's like a clippy thing that they put on, but because I had nail polish, it couldn't pick it up. So I think they tried another way. They probably put it sideways or something, I don't know, but somehow they got it. But I wasn't even aware that like having nail polish can affect the heart monitor being picked up. So I guess if you're going into surgery, no nail polish would be best probably. And she also put some like tab things on my chest. So there was 3, there was one on both sides and another one just in the middle. After she's done that, they wheeled me a little bit to the side, and that's when I got the mask on. I went on the general anesthetic, and that was administered through the putting the mask on, and they didn't really ask me to count backwards or anything like that. She just let me know I'm gonna put the mask on, and she kind of asked me a few questions which I can't remember at this point. And it took, I remembered right before I passed out, I was like, I want to remember my last moment, because I don't want it to be like, oh, I'm chatting away and then boom, I'm waking up in another place. So I kind of tried to hold on to that last moment as much as I could. I don't know why I did that, it was a bit ridiculous, but I passed out. I woke up to someone calling my name. So a nurse was sitting right beside my bed, and she was calling my name, but they were calling me by the wrong name. So my name is pronounced Aisatu, and they were saying Satu, Satu, Satu. So it's like sort of like when you're in a dream and you hear a distant noise and you're slowly waking up. So I'm guessing I must have been asleep for a lot longer than yeah, I don't know, for a lot longer after my surgery. I woke up and the nurse was sitting next to me. She's like, we've been calling your name for a while now. I'm like, oh, okay. I was so out of it. And everything was really foggy at this point. But the little bit that I could remember was another nurse came to the other side of the bed, and she brought in a clipboard, and she's like, how do you pronounce your name? I was like, it's Aisatu. And she's like, Satu? I'm like, no, Aisatu. She's like, that's probably why you didn't wake up, because we've been trying to call you this whole time and you weren't responding. I was like, oh, okay. And like, I didn't know, I was just out of it. Anyway, so that was pretty much a procedure, and that was like the step-by-step, like everything that happened. And after that, I was given a few minutes to lay down and relax. Like, all the curtains were closed. I was in a different room at this point. I think it was just in the waiting room, the patient's waiting room, I guess that's what I'll call it. And the curtains were closed, and I was just like sleeping. And then some of the nurses, they came in, they were like, oh, your partner, he's been there the whole time, he hasn't left. And at this time, it's been about 5 hours. So I felt so bad because I didn't have my phone on me or anything, because he had his phone, Danny. So I was like, crap, I hope he's eaten or whatever. But she's like, I tried to get him to leave to go get some food, but he wouldn't leave. He's been there the whole time. And I was like, crap. But I was like too foggy to even like react properly. Another thing is, when I woke up, I was shivering a little bit because I had like a bit of pain on my abdomen. The pain was like a 3 to a 5, and it kind of went away after, like, I think I got given Panadol. I can't remember. I'm pretty sure I got given Panadol, but it went away after probably like 5 minutes. So I believe I was given Panadol when I woke up. Another nurse came and she was like, would you like something to eat? I told her I would like tea, thanks, just something warm, just because of the pain that I was feeling a little bit. I thought it was gonna come back, so I asked for tea, and she brought me tea and water, and she also brought me biscuits. I could only eat one. She bought me 2 packs, and in those 2 packs there's 2 biscuits in each pack, but I could only eat one of them because I felt like I was gonna throw up. I kind of just laid there for a little bit. I don't know how much time went past, but she told me, you can get dressed now, we've brought your stuff in. The nurse was out on the other side of the curtain. She just wanted to give me privacy, but she said to me, if you need any help, just call me. I went into another waiting room. They said that I have to wait for about 30 minutes just to make sure everything is okay, and that was when they gave me some take-home instructions that they explained. I couldn't remember it. Danny was the one that was telling me everything afterwards because I was so like out of it. At that point, I had no pain. I was able to walk to the car by myself, well, with Danny with me, but I was able to walk to the car without sitting on a wheelchair or anything like that. I was told to book an appointment with my gynecologist for a 6-week checkup. For the past couple of days, I have not had any pain whatsoever. I have only had a bit of discomfort, which is probably like a 0.5, and I have a really low pain tolerance, so the pain was like nothing. It was pretty much non-existent. And I was also prescribed Panadol to take home, and I have not taken Panadol at all ever since I got home. So I'm really thankful that like everything went smoothly. My experience has been really, really good and really seamless, and anyone else that's going through this, I hope you have that same experience, and I hope everything goes really well. and I'll talk to you guys later. Thank you so much for watching. I'll see you in my next video. Bye.